Woman, birth, death, infinity.
Good afternoon, and welcome to the Your Health television program here on AMP's Cable Channel 24 and on the internet at www.ampmedia.org. Join our rotating host and their informative guest live every Monday afternoon at 4 o'clock. The purpose of the Your Health television program is to help get, make, and keep listeners and viewers like you healthy. And now, ladies and gentlemen, on with the program.
Hello and welcome to the Your Health television program hosted by the Monterey County Health Department. I'm Emily Sciolto, your host today, and just about every third Monday of each month. When disaster strikes your community, you may not have access to food, water, or electricity for some time. When that happens, what will you do? Do you have a flashlight and spare batteries handy? Perhaps you have a crank radio to tune into. Do you know how to turn the gas off at your house? How will you contact your child, spouse, or parent to make sure he or she is okay? What if you've been directed to evacuate your home or neighborhood? Do you know where to go? Or the opposite, if you're directed to shelter in place, do you have at least a few days' worth of food and water for your family and pets? As cities and towns across our county, state, and country recover from natural disasters that have spanned historic drought to devastating wildfires, earthquakes, and storms, we are reminded of the spirit of resilience that joins us together as one community and in times of great need as one family. Throughout this month of September, National Preparedness Month, we are called to revive our commitment to promoting emergency preparedness in homes, businesses, and communities countywide, and to building a Monterey County more steady, more ready and resilient than ever before. During the next hour, we'll hear from local experts on what types of disasters we are at risk for here in Monterey County and how best to prepare for those. We'll hear some very important lessons learned resulting from a major local earthquake. And finally, we'll chat with a member of the Central Coast Community Emergency Response Team to find out how to get involved in the many ongoing local emergency preparedness activities. With that, I'd like to jump right in by welcoming my first guest to the program. Sitting across from me now is Ms. Tamara Chapman. Tamara is the Hospital Preparedness Coordinator for the Monterey County Health Department Public Health Bureau. Welcome, and thank you for being here, Tammy.
Thank you, Emily.
I was going to ask you if I can call you Tammy, but I just called you Tammy.
It's perfectly fine.
Okay, good.
Thank you for asking.
Indeed. So I want to start off by taking a step back from what I had already said, and I want to explore the different types of disasters that can happen here in Monterey County specifically. So what are the variety of things that could happen? And then if you could tell us what we're most at risk for here in Monterey County.
Certainly. So generally disasters fall into a couple of different categories. There are the natural disasters and man-made disasters. Natural disasters will include things like earthquakes, hurricanes, tsunamis, tornadoes, floods, landslides, and wildfires. Natural disasters can also include pandemic disease, which is something the health department would be interested in. Man-made disasters can be intentional or not. We just passed the anniversary of the September 11th attacks, and those are clearly man-made disasters. So man-made disasters can be things that are like acts of terrorism, but also things like unintentional transportation accidents, bombs and detonations, chemical spills and releases, and cyber events. But the lines are really blurring. If you look back a year and a half ago or so, what happened in Japan, that was a combination of a man-made and a natural disaster. So in Monterey County in particular, we have several natural hazards that we'd want to be thinking about. First and foremost, earthquakes. We're also prone to wildfires, and with the Salinas and the Pajaro rivers, we have to think about flooding too. We've got a huge agriculture industry in Monterey County, so we'd want to also think about agroterrorism, but that's maybe more of something we'd think about from a mitigation perspective versus something that you should be worrying about on a personal level.
Okay. So great. How can we talk about being prepared? Now, what does this mean really, to be prepared?
Well, first and foremost, what I want to do is mention that we can't prepare for everything. You can prepare for, you can think about the effects of several types of disasters being similar. So you can sort of streamline your preparedness. Like flooding and wildfires, for instance, they're pretty disparate, but they both might require you to leave home. So you can plan for two different things by just thinking about evacuation. You might have a widespread power outage and a chemical release. Again, two things that sound quite different, but they would make you think about potentially having to stay home, so you can plan for sheltering in place and consequently self-sufficiency in the home. I think a widespread power outage is a good way to start thinking about preparedness, because it's something that can occur with a variety of hazards, and earthquakes in particular. But you asked what it means to be prepared. I didn't bring with me the textbook definition of what it means to be prepared, but it's generally a cyclic thing where you think about planning, organizing, training, and practicing in order to mitigate, avoid, respond to, and recover from disasters. It's something that takes place at many levels. It's not just a high-level national FEMA level preparedness. It's something that your household can think about, your community, which includes your schools, your businesses, and things, your healthcare facilities in particular. And then our public agencies obviously need to think about being able to respond. You mentioned resilience in your opening. So there's a lot of talk about community resilience this day, which really is the ability of a community to use its resources to respond to and withstand and recover from disasters. So preparedness doesn't just come through government actions. Individuals, schools, and businesses all benefit from maximizing their contribution to the community's resilience.
Well, yeah, so you talked about a few things there. One, you said, you know, we can't really be expected to prepare for everything. And
Right.
I like how you gave us some things that we could prepare for, some events that were similar, that required similar types of preparations. What did you say just then? You said like a chemicals exposure?
So there could be, I'd said a power outage or a chemical release. Both of those might drive you to stay in your home, so then you would want to think about sheltering in place, staying at home, and being self-sufficient for that period of time.
So it's not like we have, this is what we do when the power's out. This is what we
Exactly.
do when an earthquake happens, or when a chemical release happens.
Right. Now, from a government level, a first responder level, certainly there would be differences. You'd have your hazardous materials people, your decontamination people. So on that level, for sure, there would be some differences. But you, on a personal level, a citizen who would want to be taking care of yourself and your loved ones in your community, you can think about kind of lumping these together a little bit, or streamlining them to make it a little bit just more manageable.
Yeah, and more doable, I think,
Exactly.
for the everyday individual. Yeah. I like that. So doesn't mean you have to prepare for everything.
Right.
You can have a kit, and we'll get into that later, but one kit, you know, for a multitude of things. And we talked about, you mentioned the government and FEMA. I feel like
Yes.
when we hear about disasters, we're going to hear a lot about how the community kind of responded, and a lot about how the government worked with the community and whatnot. Very few and far between are the stories. You know, maybe those don't come out until later, the special a few years later. But the stories about the individuals' families,
Right.
and what they had with them, you know, when the event happened.
Right.
What is the deal with the government assistance and the whole government thing? I mean, isn't the government supposed to help me in disaster? You know.
Well, if you pay your taxes every April, you do have some right to expect some government help in responding to a disaster. But if you think about it, you know better than anyone what you would need in a disaster type situation. You know what kinds of medications that you would need if you needed to evacuate your home. If the power is going to be out and you have children, you know what is going to keep those kids entertained for days of no power. So in general, I think your best bet for immediate safety and comfort comes from that personal level of responsibility.
Right, so we can expect some type of government intervention if needed, if the situation warrants that. But I certainly know if I had kids, I wouldn't want government officials to keep them entertained, probably.
Right, and you would certainly want them entertained.
Indeed. So the government can help in a disaster. That's the takeaway. But
Yes.
it's always better to do what you can on an individual level, because
Certainly.
you're right. I mean, I can plan for, you know, prescription meds, hold some aside and package them with my kit. I can, you know, make the various plans that I need to make at my home. The government likely will not be helping me with those things.
Right.
So making a plan, What exactly is this? What does that entail?
Planning is really, in my mind, pre-thinking. You can do it for your home, you can do it for work, you can do it for schools. You have to think about these things. Not all disasters are going to occur when we're safe at home with our families in the evening and everyone is accounted for. So in planning, you would want to think about cases in which you might have to evacuate and you might become separated from these people. How can you get back together with them? You want to think about maybe planning for rendezvous points. The big thing, in my mind, is planning for communication. If something happens, if the earth shakes and debris is everywhere, you are going to want to know that the people you care about are safe and well, or if they're not, likewise, they're going to want to know if you're okay. So one of the things from a responder standpoint that we think about a lot is redundancy of communications, which is to say having a backup plan for that. You know, in an earthquake, the cell phones might not be functioning well, so you might think about having a plan to text, because apparently that will probably work even in the absence of decent cell phone coverage. But you know, you might want to think about having a point of contact out of town that can be sort of a relay point that everyone who might be impacted calls, you know, the uncle in Arizona who can get in touch with the other family members.
And to place that call, it would be when I called AT&T to tell them, oh, I think I'm being overcharged for this, that, and the other thing. They said, no, that's your home phone line. We recommend that you keep it there and also keep a phone handy so you can plug it into the wall.
Right.
And then that's really the deal.
Yes.
So you should make a plan to include someone outside of the area. I mean, not just outside of the zip code, right?
Right. Think about things that are, you know, like an earthquake, for instance, that could impact the whole Bay Area. So you want to be thinking about people who are maybe a little bit farther afield than you know, just the counties who are right near us.
Okay, okay. So we've talked about a little bit about making a plan, and you mentioned that communication was probably going to be the cornerstone of that plan. You want to make sure that you can communicate with your family members and those loved ones. Getting a kit is sort of, we mentioned that earlier, it sounds a little pricey. It sounds like there needs to be a lot of things involved. Should I bother?
Well, you are right in one respect. You should think about having a kit in your home, your car, and in the workplace, so it can seem overwhelming. You can get online and find some lists that will help guide you. Oftentimes you'll find a list of sort of basic things that are like basic, simple safety and sustainment things like first aid kits, fire extinguishers, flashlights, and things like that. And then you can find some slightly more elaborate lists that will get you a little further down the road, maybe keeping important documents, flares, a tent,
can opener,
a can opener, some cash on hand. So improvement at the margin, I guess. But I think you can start small. Something is better than nothing, in my opinion. So think about a power outage again. I live in the mountains in Santa Cruz County. We have power outages every winter. My house is on a well. So one day, or not one day, during a windstorm last year, my power is out for several days. And I really learned the importance of having some water on hand, for instance. And that's something that is widely thought to be one of the biggest improvements that you can make to an emergency kit is having an adequate supply of water. And you can, if you're buying it in the gallon jug quantities, you can stock up on water. They recommend about a gallon per person per day, not including your pets. You can get that for probably under $1 a gallon. Wow,
and I have heard also on that under $1 note that the dollar store is actually a great place to get some of these items on these lists.
Absolutely.
So, I mean, the short and the long of it is, yes, you should definitely bother with the personal preparedness kit. Because, like you said, there's a lot of sort of nuanced things about our community and about folks that live here. Wells, for example, mountain terrain. So that puts you at risk for any number of things. Interesting. So what are some other strategies for building this kit? We've got lists online. I know that you can go to FEMA.gov and get one of these lists.
Right.
What other strategies can you provide?
So I'll give you a couple that I use in my own personal preparedness. One is siphoning off a little bit of what you buy on a regular basis. You're buying trash bags. Trash bags are good to have in your emergency kit. Throw one or two in your disaster kit when you buy them. Grab a roll of toilet paper when you buy toilet paper. diapers for your kids, or when you go to your dentist appointment, grab that spare toothbrush that you just got, throw that in your disaster kit. You want to keep maybe some extra clothes in there. So say you have some jeans that have a small hole, or maybe aren't the style you want to wear anymore, put them in your disaster kit. The other strategy that I use in my own house is just changing the organization. So I have some bins of items that are specifically there for a disaster kit, but I keep them co-located with my camping supplies. So I've got my tent, my backpacking stove, and my water filter right nearby. So if I were to need to evacuate, that stuff is all very handy for me to grab.
Yeah, and camping supplies are pretty similar to, well, in the basic gist of what you would need for a disaster.
Very much so. Very much so.
And you mentioned about placement. Now, I've got some plastic bins that I bought from Target. I also store things in my garage in them. It's probably not the best idea to store those in with all the other storage at the bottom of the pile.
Right. You want to keep the stuff accessible. I have mine in my shed right now, but is my shed key in the most convenient location? Probably not. I should be working on that.
Okay.
Yeah.
So we've all got some takeaway, it sounds
Absolutely.
like, from today's.
And like what I said before, doing a little bit of something is better than nothing. Okay. And we've got just a few more minutes here. I want to ask you, you focus on medical preparedness in your work. Yes.
What should we know anything about that? Should we know anything about that? Or if so, what do you think?
Yeah, well, I do want to let everyone know that hospitals do practice for this kind of stuff. Hospitals in Monterey County participate in it's called the statewide medical and health exercise every year. Last year, the exercise scenario was keeping operations running in a power outage, or pardon me, in a water disruption. This year it will be a power outage.
Okay.
Hospitals also exercise patient surge, which is something, patient surge is the arrival of a larger than normal number of patients to a hospital, which is something that you would see in a disaster. That's something that they practice or experience every year in order to maintain their accreditation, actually.
Oh, okay.
And I also wanted to point out that medical entities, they're a part of the community too, so they might be facing some of the challenges that you would face personally. They might be low on staff because they're impacted by the disaster, and they might have infrastructure issues. Certainly we work to mitigate those things, but like I said, it is a part of the community.
So if something were to happen, if you should be hurt, someone that you're, close by should be hurt, accessing care for a number of reasons might not be easy.
Right.
Even if you're right at the hospital.
Exactly. Certainly that doesn't mean that you should abstain from trying to access medical care if you need it, but it might be more of a challenge than usual.
Okay, good tip. Lots of good tips, actually.
Thank you.
Tammy, I want to thank you again for talking with me today and, again, providing our viewers with some of those very essential preparedness strategies. I feel like we got a close look into your, behind the Tammy's music on preparedness strategies. Thank you for those. If you'd like more information on how to build a kit, make a plan, and stay informed, visit ready.gov on the web. Again, that's www.ready.gov. Right now we're going to take a short break, but don't touch that dial.